Coping with anxiety. That's the topic today, and we're going to talk about some cognitive tips for coping with anxiety. So what are cognitive tools? It's just a fancy way of saying tools in your brain, thinking tools, as opposed to changing the way you sleep or eat or exercise or anything like that, or medications. So number one, thoughts lead to feelings. What does that mean? So when you're feeling anxious, the first thing to do is remember that it is your thoughts that make you anxious. It is nothing in the external environment that makes you anxious. So we have an anxiety response. We have a panic response for a reason. It's because we need to be able to feel anxious. Say if we're getting chased by some vicious beast. So we need to be able to feel anxious in stressful situations. But for the most part, anxiety, if it's pathological anxiety, is not useful. So the first thing to understand is that your anxiety is not coming from things outside. It's coming from your internal thoughts. It's coming from whatever it is that you're thinking in your head. So whatever the situation is that you're in, if you can change the way that you're thinking about it, you can change the way that you're feeling about it. Thoughts lead to feelings, not the other way around. This is not easy. We spend our lives trusting that our brains are sending us correct messages. So when our brains are sending us a message that there's something to fear, it's very difficult to then change that thinking. What we're thinking is causing us to feel anxiety. Number two, thoughts can't hurt you. So, for example, you're having a panic attack and you feel like you're going to die. So the thoughts that you're having are, I'm going to die. You want to remember thoughts cannot hurt you. You cannot die because of the thoughts that you're having. Similarly, in a social situation in which you might feel like you're going to faint or collapse or whatever, the thoughts you're having will not hurt you. They cannot cause those things to happen. So the next time you're feeling anxious, what you want to say to yourself is, just because it's in my brain, just because I'm thinking it, does not mean that I can cause it to happen. My thoughts cannot hurt me. Number three, you want to ask yourself, what is the worst thing that can happen? You want to identify your very worst case scenario. So for example, with the panic attack again, if you're afraid you're going to have a panic attack in a certain situation, you want to identify that and then recognize no one ever died from a panic attack. You will not die. In addition, you may be able to mitigate that by having a support system in place, a friend, perhaps having medication with you if that's available to you, having a plan B if that's a possibility, someplace you can go, somebody you can call, something like that. Some people may have social anxiety and be worried that if they go to a party or they engage socially, they will humiliate themselves and feel embarrassed. That's another situation where you can imagine the worst case scenario and follow it all the way out to the end and really look at it logically. Number four, take very small steps and be very patient. And this is hard sometimes because we want to get rid of all this anxiety all at once. Most people who've experienced anxiety have experienced it for a long time, and their brain is programmed to experience anxiety in this way and to think this way. If you are socially anxious, you wouldn't want to, as a first step, go to an incredibly big social event. You might want to do something one-on-one. Or if you have a phobia of elevators, you wouldn't want to first take an elevator to the top of the Empire State Building. You might want to try just visualizing taking an elevator. So those are really almost silly examples, just small examples, but You want to make sure you do really small things and not move on to the next step until you feel very successful with the step that you are on. That's the way that these cognitive tools can be most useful for most people. And then, of course, never hesitating to reach out for help from your support network or from professionals if that's available. Number 5, if all else fails, fake it. So what do I mean by this? Well, in a way, we can fool our brains into thinking that we are calmer than we really are. The same way that our brain is sending false messages to our body, telling us to be anxious and frightened, we can actually force our bodies to be calm, sending false messages back to our brain. Breathe slowly. 3 counts in, 3 counts out. Relax your body with an open body posture. Talk to someone you trust slowly and calmly. Redirect your attention to something that is relaxing. As your body physically relaxes and your nervous system physically relaxes, it sends messages to your brain that there is nothing to be afraid of. Your brain then says, oh, nothing to be afraid of, and sends messages back to your body to calm down. And the cycle goes in an opposite direction. So when I say fake it, what I mean is make your body fake it like you're actually not nervous, not anxious, and not afraid. So let's review these small things you can do cognitively if you become anxious. Remember, thoughts lead to feelings. Thoughts can't hurt you. Ask yourself, what's the worst that could happen? Take small steps and be patient with yourself. If all else fails, fake it. Okay. So remember, treating anxiety can be a whole lot more complicated than what I've presented here, but what I'm trying to do is offer some tips for things you can do for yourself if you're feeling anxious acutely. Some of these treatments will be topics for future videos, so keep an eye out for that. Make sure you've subscribed and hit the notification button so you don't miss anything. But that's it for today. Thanks for listening, and I'll see you next time.